Morning, everyone. Hopefully you can all hear me. Could a couple of you just send me an email there on the chat just to confirm that everyone can hear okay? We'll just test that before we start. Perfect. Thanks, Grania. Okay, thanks a million. You're all very welcome this morning to the first webinar that we have as part of Construction Safety Week. So this morning's topic is mental health, welfare and well-being. So for the next 35 minutes, I just want to take you through a few slides and thank you again for your attendance. And if anyone has any questions or comments, you can just send an email on the chat. I'll just share screen now. Excellent. I suppose just before we begin, I suppose just very quickly, mental health, welfare and well-being is the topic. As we know, mental health refers to our, it's our emotional state, it's for psychological and social well-being. It impacts the way we feel, the way we think, and I suppose it's an important part of everything we do, either at home or at work. It also obviously plays a critical role in how we deal with stress, little pressures every day, any setbacks, and how we relate with others. And in particular, the decisions we make every day are impacted by our mental health. And these decisions not only impact ourselves, they impact our families, our work colleagues, and others around us. And it also obviously feeds into the health and safety of everyone we interact with, in particular at work. Without positive mental health, it's near impossible to realize our full potential, either at home, or to work productively, or even to play a meaningful part or a meaningful role in our families' lives, in our communities, and in our workplace. So just before I get into the slide deck, again, it's just a reminder, having positive mental health is very important. It's critical for all of us. And in addition to seeking professional help, if you need it, it's important also, obviously, to, remember that networking, engaging with people, mixing with people, staying physically active, eating and resting well, and learning to switch off are all key tools and enablers for us to ensure we have a positive mental health and that we look after our well-being. So just some stats initially to kick it off, just as a reminder for everyone, each year, 25% of the population suffer from varying degrees of depression or anxiety. That's 1 in 4 of us. Neuropsychiatric disorders account for close to 20% of the burden of disease in the European region and 26% in the European Union, in terms of the European countries. People have lived 40% of their lives with depression, which has been undiagnosed or untreated. It's a very large statistic, and over 50% of all chronic sick leaves across the workforce. It's stated that these are due to various levels of depression and anxiety. Most of the time, the people around you will not understand your journey because they don't need to. It's not for them. It's your journey. It's for you. And it's important that the supports are there for any one of us on that journey so that we can help you and so that the assistance is there and that someone is there to help you when you need it. Over 50% of major depressions, as I've said, remain untreated. It's a significant cost across the EU. It's over 170 billion euros. And in particular, whilst we're seeing the suicide rates are dropping across Europe over the last 20 years in most countries, in fact all, it's a trend in particular for males, which is the exception here in Ireland. Stigma, discrimination against patients and families affected by mental illness very often prevents people from seeking specialized care. Bill Clinton once said at a conference that mental illness is nothing to be ashamed of, but stigma and bias is a shame on us all. So just to talk very briefly on, creating awareness and dealing with stigma. While awareness of mental health has increased, certainly has increased in recent years, poor mental health can still be stigmatized and very often is, still to this day, this week, next month, people will feel uncomfortable with coming forward with a particular issue which is concerning their mental health because of a fear of stigma and a fear of, I suppose, bias and, what people might think or talk about them. So it's very important in terms of dealing with stigma that we talk openly about issues or concerns that people have. We obviously create awareness around our mental health and well-being and its importance, hence the importance of this topic this morning and creating awareness this week. We also need to educate everybody, each one of us as individuals, our teams, our families, anyone who we interact with around mental health. And we also need to share tips and encouragement for each other in ensuring that we do what we can to stay positive and to improve our mental health. There are many support programs there. There's help to be had if people need it. In particular here in EPS, we've obviously got various support available through BUPA and through LEA. And there's a very confidential service here for anyone who wishes to use it. And if at any stage you feel that you need to talk to somebody, you're uncomfortable talking to a family member, you're uncomfortable talking to a friend, you're uncomfortable talking to a work colleague, there's both numbers here for you to call, whether you're based in Ireland or whether you're based across the UK, and you will get to talk to somebody. And there are obviously other call numbers as well that are publicly advertised with various agencies that provide someone to listen and someone to talk to. And it's important that people avail of that opportunity if you're uncomfortable with obviously talking in the first instance to a friend, family member, or even a work colleague. Just to remind ourselves on, some positive tips. And as I would have said a number of weeks ago on the employee update for everybody, we're in for a particular difficult 6 months, weather, COVID restrictions, and many challenges that people wouldn't have had in previous years. And it's important just to briefly remind ourselves on some of the, the tips that are there to ensure that each individual and each one of us does our best to ensure we have and remain with a positive mental well-being. Obviously, you need to eat well, have a balanced diet, rest well, take up something new. It can be anything, it can be something outdoors, indoors. It could be something around art, walking, take up a bit of farming, get involved in your community. There's a whole host of things you can do, in particular around exercise. As I've said earlier, it's important to maybe ensure you do talk to somebody, and in particular, someone you can trust. Never drink alcohol in excess. In particular, take time to switch off and take time to relax. Spend some time outdoors. If you're not somebody who particularly likes going outdoors and doing activity, now's a good time to take it up and try it out. Be kind to yourself, set reasonable goals, set yourself a challenge. Many people, in particular at Christmas time, set themselves a few challenges for the year, a few goals. And it's something that they, it might be, whether it's Couch to 5K for people that do running or whatever, they just take something up to do something different, to get active and set themselves a goal for the coming year. It's important that people maybe might bear that in mind in this coming months. As I said, stay active, stay physically active. If you're not physically active, you need to get physically active, whether it's walking, running, hill walking, or whatever. Keep in touch with people, in particular with the current stage of restrictions that we're now faced with. Obviously, there have been a number of changes and announcements around restrictions in the past number of weeks, right across Ireland, and more coming this week, and also across the UK last week, and in Northern Ireland and Scotland. So it's important that people, we're going to be spending more time at home. We're going to be spending more time not attending events, not going out, meeting people in our communities that we would traditionally be accustomed to. So it's important that people keep in contact, whether, by phone, by Zoom, or whatever means works for you. And as I said again, just to remind you, there are people there to listen to you, but just ask for help. Again, maintaining good mental health during COVID, as I've said, keep yourself informed. Have a routine. If you don't have a routine at this stage, I know most people will have since March. But if you don't, if you're one of those people that doesn't have a routine, it's important that you actually set one for yourself. Minimize your news feeds. Again, that's basic. Don't be reading everything or believing everything you see on Facebook, on Twitter, on the paper, on the news. Keep focused on what information you really believe in, and obviously always trust and take heed of the advice and guidance or any stats that are provided from authorized agencies or authorized points of information feed. But don't get caught up in the spin, because there's a lot of it out there. As I've said, social contact is extremely important, so ensure that you mix and keep in contact with people. Alcohol and drug use, obviously a very obvious one. In particular, we're seeing the trends. If you read some of the news feeds on some of the updates from public health authorities, alcohol consumption in the home has increased significantly, in particular during the lockdown. And drug use, you obviously shouldn't be doing drugs in the first place, but if you are somebody who tends to enjoy smoke or an odd ecstasy or an odd line of coke, it's not the time, now's the time to be giving that up. It's certainly not the time to be trying it at home, because it's just not good for you. Screen time, obviously be conscious of your usage of digital tools and how long you spend on your phone and various apps. Ensure you help others. If you notice they need some help, support healthcare workers, in particular at this time, a very difficult and challenging job. And it's important that we take cognizance of that. And please don't discriminate anybody who has tested positive for COVID or any of their family members. It's not their fault. And more so than anything, I think in the last week and a half to 2 weeks, personally myself, I knew nobody, bar 1 or 2 people, who had tested positive and contracted COVID since March up to 2 weeks ago. In the past week to 10 days, I know numerous people, probably 20 or 25 people. So it's definitely out there a lot more, as you're all aware. But it's in particular, it's not something we should be discriminating people on, because they have enough to be dealing with and enough to be worrying about in terms of their own health and their families, than to be worrying about people discriminating against them because they've unfortunately contacted COVID-19. And finally, I think just another reminder around contacts for our employee assistance program. And I just want to remind people, Bill Clinton, Barack Obama made a speech at a national conference in July 18, and he referred to mental health conference. And he referenced that it was too often we kind of whisper about mental health and well-being, and we avoid asking ourselves or asking others all of the questions that need to be asked around our mental health and well-being. And the point he made was our brains are a body part, no different than our hand or our foot. We just know less about it. So there should be no shame in discussing or seeking help for something that is treatable and that affects too many people that we know and too many people that we love. And I refer you back to the stats where 25% of people at some stage in their lives will be impacted at varying levels with depression and anxiety. That's 1 in 4 of us. So in EPS, we've over 500 people across the group. That's 125 people today potentially are or have been or could be impacted or affected with their mental health. So it's important to remember that large stat. So it's important we support each other. And again, finally, just to remind you all around our COVID-19 prevention measures in terms of washing our hands and disinfection, wearing our masks, avoiding obviously contact or touch points, clean and disinfect regularly, obviously stop shaking hands, which 99% of people have now done, and maintain your social distance. So that's the webinar for this morning. Look after yourselves and thank you for your time.